So I was really delighted to present the data on PSMA-4, which is a phase 3 trial looking at lutetium PSMA in patients with metastatic castration-resistant prostate cancer who have already experienced cancer progression after an androgen receptor pathway inhibitor. So these patients may go for docetaxel chemotherapy as a standard of care, but really in this trial we focus on patients who are not really candidates for immediate chemotherapy because they had more indolent disease, they had just a few symptoms or no symptoms at all, or they were not really willing to go for chemotherapy immediately. So for these patients, we knew already that lutetium PSMA was potentially an active treatment thanks to another phase 3 trial called VISION in more advanced disease, where lutetium PSMA already approved overall survival and quality of life. So the idea in PSMA-4 was really to test this treatment earlier in the course of the disease. So patients again were randomized on a 1-to-1 fashion. Either they received lutetium PSMA immediately, or they received a second androgen receptor pathway inhibitor, and then at progression, they could receive lutetium PSMA. So it was a nice deal with the patient to get access to treatment, either right now or in a different manner. So what the trial shows is that the primary endpoint, which is radiographic progression-free survival, is very clearly improved. It's really doubled, basically 6 months as a median in the control arm versus more than a year with lutetium PSMA. Very clear difference. And this is really what the agencies, the regulatory agencies, want to see first. Now, what we also assessed is overall survival because we want to make sure that using a radioligand earlier in the course of a disease does not impact negatively on overall survival in the long term. And it's not the case. The hazard ratio is less than 1. This is reassuring. Third, we looked at quality of life and pain. Because of course, not only we want to do good things for the patients in terms of postponing imaging-based progression, but we want to directly improve patients' life, if you will, or avoid deterioration in their quality of life. So quality of life was measured using 2 different questionnaires, and actually the data are very similar. We improved time to deterioration in quality of life by approximately 40%, which is good. And this is true in terms of physical well-being, emotional well-being, functional well-being, all what is important in quality of life. Also for pain, time to deterioration of pain was improved by 30%, which is very important in prostate cancer because patients have typically bone metastasis, which can be painful, and then can also develop local progression in their pelvis, which can be also associated with pain. So it's very good to see that we are directly improving patients' outcomes. So I think we have now a nice picture, and this is complemented by the side effects, the safety profile of the drug, which is very clean, to be honest. We are improving time to progression of cancer, whatever the way we measure it. PSA, imaging, quality of life, pain, all this is improved by lutetium PSMA. Safety is really mostly fine. It's really mostly non-toxic. And in the context of a strong crossover, 80% of patients received crossover to lutetium PSMA in the control arm. Overall survival is not negatively impacted. So I think we have a nice file, if you will, to convince all ourselves and all the colleagues and hopefully the regulatory agencies to have this treatment soon for all the patients. Well, I think the next step will be to test this very same treatment even earlier in the course of a disease. And for example, for men with metastatic castration-sensitive disease, the PSMA addition trial has completed its HRQoL. We are following these patients, and hopefully in 1 or 2 years from now, we will be able to look at the data.